Perfect. How's everyone doing today? All right. So as far as I'd mentioned, my name's Eman Namati. I'm the CEO of SpectraWAVE, and really excited to share the SpectraWAVE story with you today. Our vision here at SpectraWAVE is really to save the lives of patients with cardiovascular disease, the #1 cause of mortality, not just in the US, but globally. And the mission, the work that we're doing every single day is really to bring together the latest in optical and computational methodologies to improve the outcome and treatment for patients with coronary artery disease. So as many of you know, patients who have angina, whether that be chronic or acute, are typically indicated to come in for a diagnostic angiogram. This is performed about over 12 million times a year globally. And here, an interventional cardiologist is evaluating the major arteries of the heart that feed the muscle for any significant stenosis or restriction of blood flow. If they find a blockage, the best path for those patients is to do some type of revascularization, typically angioplasty or nowadays stenting. And in that setting, it's now unequivocal that intravascular imaging for the planning and the optimization of the stent placement provides significantly improved outcomes. And not just, just from a restenting and thrombosis, but all the way through to cardiac death and all-cause mortality, which is an incredible improvement in these patients' lives. Now, in the last 5 years in particular, this field of using intravascular imaging for PCI, percutaneous coronary interventions, has grown in a pretty significant manner. You can see here on the graph on the left, these are a combination of inpatient, outpatient procedures that use intravascular imaging. It's now north of 25% in the US. And this growth has really come from the clinical evidence and the recognition of the improved outcomes. And just in this last 12 months, we now see that the European guidelines have moved intravascular imaging to a 1A recommendation. And just a few weeks ago, the same happened in the United States, which is a really big deal, 1A being the strongest level of recommendation with the greatest level of evidence for a technology or therapeutic in this space. Now, interestingly, the market-leading products that are out there, and you can see this competitive landscape that we've laid out here in this table, the trade-offs that the physicians need to make are across image quality and ease of use. And this has been a big focus for us at SpectraWAVE. We have really pushed the envelope on a core technology called optical coherence tomography, an optical-based structural technique. And we refer to it as deep OCT, based on the improved depth and image quality, as well as the underlying deep learning technology that we've used. We've combined that with spectroscopy for lipid detection, and then just overall have made this procedure a lot simpler. So the device itself, which you'll see right here, is a no prep, no flush catheter. It's a class-leading low-profile device with the longest and fastest pullback of these competitive devices, and it allows for very rapid acquisition of the scan. We have really layered around this core tech a comprehensive set of AI and classical image processing algorithms that truly take the guesswork out in this intraoperative procedure. And because all of the key analysis is done in an automated way, physician can actually do the full analysis within the sterile field at the bedside. And that provides for a very efficient use of this technology. Just to look at the image quality difference between what we're bringing to market and what is historically available. Here is an example of a patient who was scanned with both a competitive OCT product and our product back to back. And you can very quickly appreciate the incredible depth and image quality that we provide. And this is clinically significant. So today, calcium is a big deal for these patients and the interventionalists as they're evaluating how to treat the patient and how to prepare the vessel. And here we can see the full thickness of the calcium. But also the spectroscopy allows the physician to confirm that there's also lipid visible in this frame. Here's another example going head to head. Here you can actually clearly see this dark black band, this actually represents the external elastic lamina, or is typically coincident with the native dimension of the lumen before the disease takes place. And so this is really critical for stent sizing, because this is what you want to revasc to bring back the normal physiologic flow in this vessel. Here are a couple examples against intravascular ultrasound, and here you can very quickly appreciate that with ultrasound you can't actually see beyond the calcium wall. Here you can measure the full thickness, and this becomes really important again for determining what kind of modification to perform on these vessels. Another example in IVUS, again, really day and night difference between image quality and the ability of a physician to very quickly determine what to do in this case. So as I mentioned, the product itself is very rapid, so less than 1 second full acquisition. But then within a few seconds, all of the key information is analyzed and presented for the user. Here's an example where a physician has effectively landed in the stenosis and then moved to the left and to the right, to the proximal and to the distal end, and placing flags where they would like to place the edges of the stent. And then the system automatically, as you can see here, determines the full geometric information that's needed to determine the stent size and location. And then this is automatically registered back to the angiography image, providing for very precise guidance in the intervening procedure. Once the stent is placed, they rescan the vessel, and here we automatically determine where the stent is. We calculate the reference diameters and then determine if there's an underexpansion. And you can see that here in the highlighted red zone, which is also automatically co-registered to the angiography system. So it really makes a procedure that historically has been a little bit cumbersome and time-consuming very rapid, simple, and provides very high confidence. So we've had just incredible positive reception to the product, both in our preclinical or pre-commercial clinical studies, as well as our commercial deployment to date. And really on the back of this, we were able to raise a significant financing last year, led by Johnson & Johnson, as well as participation by a number of really top venture groups in the medtech space. And then that is now allowing us to fuel our commercial deployment. So in addition to the commercial path that we're on, we have continued to innovate, and we have a deep product development pipeline. The first product that we are releasing soon will be a wire-free physiology add-on. So this will be a software-only addition to the platform, and it provides direct ability for the physician to use our product to determine whether or not they should treat or not. So effectively looking at the stenosis based on the angiography data itself. And we're already seeing some really great results here in our clinical setting. Very commonly seeing this product be used and perform the full end-to-end FFR in less than 60 seconds, which we believe will also be a class-leading product. So just to wrap up here, really incredible product that we've now brought to market. We're in the early commercial phase. Fortunately, had some great support over this last year by our original financing group, and then now this really great coalition. We are taking this product from a best-in-class intravascular imaging and continuing to expand to become really the one-stop and diagnostic hub for the cath lab. So a really exciting area. Couldn't have been done without just an incredible team. Just a quick kind of snapshot of the executive team. So we recently actually added a chief commercial officer, chief financial officer, and chief medical officer to help fuel the growth over the next 24 months. So really excited. Thanks again to LSI for giving us this opportunity to share the story.